Welcome to our educational video on common and dangerous diseases in dogs. In our time together, we're going to navigate the often intimidating world of canine health. We'll discuss some of the most common diseases that could affect your four-legged friend, from the highly contagious canine parvovirus to the life-threatening gastric torsion. Our journey will not only delve into the symptoms and causes of these conditions, but also their prevention. Because while some of these diseases may sound scary, armed with the right knowledge, we can do our part to keep our canine companions as healthy as possible. So sit back, grab a notepad if you wish, and let's embark on this educational journey together. Today we'll explore the symptoms, causes, and prevention of these conditions to keep our canine friends healthy. Starting with canine parvovirus, a highly contagious viral disease. This notorious illness is particularly dangerous for puppies and young dogs. The symptoms can be severe, ranging from intense vomiting and bloody diarrhea to life-threatening dehydration. Now, you might wonder, how does this virus spread? It's through something called fecal-oral contact. This means that dogs can pick up the virus from contaminated feces, soil, or objects. This is why vaccination and maintaining good hygiene are absolutely crucial for prevention. By taking these steps, you can help protect your canine companion from this potentially deadly disease. Next, canine distemper, or moquillo, is a viral disease that has a severe impact on a dog's respiratory, gastrointestinal, and nervous systems. Dogs affected by this disease often display a range of symptoms that can include a high fever, a persistent cough, and a runny nose. As the disease progresses, more serious symptoms may emerge, such as seizures. This disease is particularly treacherous for its airborne nature, making it incredibly easy for dogs to contract, especially if they're in close quarters with an infected animal. As with many diseases, prevention is far more effective than treatment, and the best way to prevent distemper is through regular vaccinations. Vaccination is key to prevention, as the disease is airborne and highly contagious. Leptospirosis is a bacterial disease affecting the liver and kidneys. This nasty infection is transmitted through the urine of infected animals and is a zoonotic disease, meaning it can also affect us humans. Dogs may come into contact with the bacteria in several ways, but most commonly, it's through drinking, swimming in, or walking through contaminated water. The symptoms of leptospirosis in dogs can be quite variable, but often include fever, muscle pain, vomiting, and jaundice, which is a yellowing of the skin and eyes. In severe cases, it can lead to kidney damage, liver failure, and in the worst-case scenario, death. So, how can we prevent our canine companions from contracting leptospirosis? Firstly, there's a vaccine available, which is highly recommended, especially for dogs that spend a lot of time outdoors or in areas where the disease is prevalent. Secondly, try to prevent your dog from drinking from or swimming in stagnant water bodies, as these can potentially be contaminated with the bacteria. Remember, early detection is key, so if your dog shows any signs of illness, it's always best to consult with a vet as soon as possible. With the right preventive measures and prompt treatment, leptospirosis can be managed effectively. Vaccination and avoiding stagnant water can prevent infection. Rabies, a fatal viral disease, affects the central nervous system. This notorious disease is most commonly transmitted through the bite of an infected animal. In its early stages, it might be hard to detect, as the symptoms can be quite subtle. A dog may show signs of fever, changes in behavior, or difficulty swallowing. As the disease progresses, more severe signs such as paralysis and aggression may occur. The real danger of rabies lies in its fatality. Once symptoms appear, the disease is almost always deadly. This is why prevention is of utmost importance. Vaccination against rabies is not just crucial for our canine companions, but it's also a legal requirement in many regions. By vaccinating our dogs, we're not only protecting them, but also ourselves and our communities from this deadly disease. So remember, vaccination is vital, as rabies is deadly and has no cure once symptoms appear. Heartworm disease, caused by mosquito-borne parasites, poses a serious health concern for our canine companions. This insidious disease primarily targets the heart and lungs, leading to a host of complications that can range from mild discomfort to life-threatening conditions. Symptoms of heartworm often don't appear until the disease has advanced, making early detection quite challenging. When symptoms do occur, they may include a soft, dry cough, reluctance to exercise, fatigue after moderate activity, decreased appetite, and weight loss. In severe cases, dogs can suffer from heart failure and the appearance of a swollen belly due to excess fluid in the abdomen. The transmission of heartworm is an area of concern as it's not passed directly from one dog to another. Instead, the disease is spread through the bite of a mosquito carrying the heartworm larvae. When the infected mosquito bites another dog, the heartworm larvae are deposited onto the surface of the dog's skin and enter the new host through the mosquito's bite wound. Prevention of heartworm is far easier, safer, and cheaper than treatment. There are several FDA-approved heartworm preventatives available, which are typically administered monthly. These medications can be in the form of a pill, a topical liquid applied to the skin, or an injectable drug given every 6 months. In stark contrast, the treatment for heartworm is a complex and costly process that can be risky for the dog. It often involves a series of injections and strict rest to prevent complications. Therefore, it's crucial to prioritize prevention over treatment. Prevention is through monthly medications, as treatment for the disease is risky and expensive. Remember, the key to a healthy dog is regular checkups, preventative care, and a whole lot of love. Dogs often face internal parasites like roundworms and external ones like fleas and ticks. Let's delve into this issue a bit further. Internal parasites, or worms, live inside your dog's body, usually in the gastrointestinal tract. They may include roundworms, tapeworms, hookworms, and whipworms. These pests can cause a variety of symptoms such as weight loss, vomiting, diarrhea, and a dull coat. On the other hand, external parasites like fleas and ticks latch onto your dog's skin, causing itching, redness, and even severe diseases like Lyme disease or Rocky Mountain spotted fever. Transmission of these parasites can happen in various ways. Your dog can ingest worm eggs from the environment, from infected prey, or from the mother's milk. Fleas and ticks, on the other hand, generally infest your dog when he's outdoors, especially in wooded or grassy areas. So how can we protect our beloved canines from these pesky parasites? For internal parasites, regular deworming is key. Your vet will recommend a schedule based on your dog's age and lifestyle. As for external parasites, there are many effective preventatives available, including topical solutions, oral medications, and special collars. It's also important to check your dog's skin and fur regularly, especially after walks in the great outdoors. In conclusion, regular deworming and flea tick preventatives are essential to keep these pests at bay. A parasite-free dog is a happy and healthy dog, and that's what we all want for our four-legged friends. Lyme disease, transmitted by ticks, causes fever and joint pain. A tick, particularly the black-legged tick, transmits the bacteria causing Lyme disease when it bites and feeds on the dog's blood. The bacteria then spreads in the dog's body, causing a host of symptoms that can be mistaken for other conditions. Symptoms can include fever, lethargy, loss of appetite, and lameness due to joint pain. In severe cases, Lyme disease can lead to kidney damage, and in rare instances, can cause heart or nervous system complications. Prevention is the best approach to Lyme disease. Regular checks for ticks, especially after walks in wooded or grassy areas, can help spot and remove any ticks before they transmit the disease. There are also several tick control products available that can kill ticks or make your dog less appealing to these parasites. In areas where Lyme disease is prevalent, a vaccine may be recommended by your vet. But remember, the vaccine doesn't provide complete protection and should be used in conjunction with other preventive measures. Tick control and prompt removal are vital, along with vaccination in endemic areas. Pancreatitis, inflammation of the pancreas, is triggered by high-fat diets or obesity. This condition can be quite uncomfortable for our four-legged friends, causing symptoms like vomiting, loss of appetite, and abdominal pain. The pancreas plays a crucial role in digestion and insulin regulation, so when it becomes inflamed, it can affect your dog's overall health and well-being. The main causes of pancreatitis in dogs include fatty meals and obesity, but in some cases, it could also be due to certain medications or diseases. Prevention is always better than cure, so ensuring your dog has a balanced, low-fat diet and regular exercise can help prevent this condition. If your dog is showing any signs of discomfort or changes in behavior, it's always a good idea to consult with your vet. In conclusion, a low-fat diet can prevent flare-ups. Gastric torsion or bloat is a life-threatening emergency where the stomach twists, trapping gas. This condition is as painful as it sounds, causing distress and discomfort in our four-legged companions. The signs to look out for include a swollen abdomen, restlessness, excessive drooling, and attempts to vomit without any result. The exact cause of gastric torsion remains somewhat of a mystery, but it's believed to be associated with large meals or rapid eating, vigorous exercise after eating, and genetic predisposition. Certain breeds with deep, narrow chests like Great Danes, St. Bernards, and Weimaraners are particularly susceptible. The treatment for gastric torsion is immediate veterinary intervention. This is not a condition that can be treated at home or left to resolve on its own. Emergency surgery is often necessary to untwist the stomach and potentially tack it in place to prevent future episodes. Prevention strategies include feeding your dog smaller, more frequent meals, discouraging rapid eating, and avoiding strenuous exercise right after meals. It's also recommended to be familiar with the symptoms and act quickly if you suspect your pet might be suffering from gastric torsion. Remember, large breeds are at higher risk, and prompt veterinary intervention is crucial. Canine infectious hepatitis affects the liver, causing fever, vomiting, and jaundice. This disease is a viral infection that can be quite severe and is most commonly seen in young, unvaccinated dogs. The virus is typically transmitted through the urine, feces, or saliva of an infected dog, and the incubation period can be as short as 4 to 5 days. Symptoms of infectious hepatitis may include lethargy, loss of appetite, fever, tonsillitis, and a painful abdomen. As the disease progresses, the dog may develop jaundice, a condition where the skin, gums, and whites of the eyes turn yellow. This is due to the liver's inability to process bilirubin, a byproduct of red blood cell breakdown. In severe cases, this disease can lead to blue eye, a condition characterized by a cloudy appearance of the eye due to inflammation of the cornea. It can also cause bleeding disorders due to a decrease in blood clotting factors produced by the liver. But here's the good news: prevention is possible. A vaccine is available for infectious hepatitis and is typically given to puppies as part of their initial series of immunizations. This vaccine provides excellent protection against the disease. It's also important to keep your dog's environment clean, especially if it's been exposed to an infected dog. Remember, being proactive about your dog's health can make all the difference. Vaccination can prevent this viral disease. Canine parainfluenza virus leads to respiratory illness, part of the kennel cough complex. This illness is seen commonly in dogs who spend time in communal settings, like dog parks, kennels, or shelters. It's an airborne disease, spread through direct contact with respiratory secretions or through the air, making it highly contagious. Dogs affected by parainfluenza may show symptoms like a persistent cough, sneezing, or nasal discharge. These signs might seem mild at first, but can lead to severe complications if not treated promptly. The best way to prevent parainfluenza is by maintaining good hygiene practices, such as regular cleaning of your dog's living area and avoiding contact with sick dogs. Moreover, a vital part of prevention is vaccination. There are vaccines available that can protect your dog from this disease. Remember, prevention is always better than cure. Good hygiene and vaccination reduce the risk of this airborne disease. Cancer in dogs can manifest in various forms, with varying symptoms like lumps, lethargy, or weight loss. Just like in humans, cancer in dogs involves the abnormal growth of cells that have the ability to invade or spread to other parts of the body. It can occur anywhere in the body, affecting a wide range of systems. The exact causes of cancer in dogs remain unknown, but factors like age, breed, environmental influences, and genetic predisposition play a significant role. Treatment options depend on the type and stage of cancer. They may include surgery, radiation therapy, chemotherapy, or a combination of these. Some forms of cancer can be cured if caught early and treated effectively, while others may not be curable, but can be managed to improve the quality of life for the dog. Early detection and treatment are critical for better outcomes. Regular veterinary checkups and being vigilant for any abnormal signs in your dog's health can greatly assist in early detection. Remember, our four-legged friends rely on us for their health and well-being. Addison's disease, or hypoadrenocorticism, is a condition that affects our canine companions when their bodies produce insufficient adrenal hormones. This deficiency can lead to a variety of symptoms, including weakness, lack of appetite, vomiting, and diarrhea. Some dogs may also experience shaking or tremors, while others may have a slow, weak pulse. The cause of Addison's disease is usually damage to the adrenal glands, often as a result of an autoimmune response. This means the body's immune system mistakenly attacks its own tissues, damaging these vital glands. Diagnosing Addison's disease can be a bit tricky, as its symptoms can be quite similar to other conditions. Veterinarians typically use a combination of blood tests and an ACEH stimulation test, which measures the adrenal gland's response to a hormone called adrenocorticotropic hormone. Once diagnosed, the good news is that Addison's disease is usually manageable with medication. Dogs with this condition will typically need to take a corticosteroid to replace the hormones their bodies aren't producing in sufficient amounts. They may also need a mineralocorticoid, another type of hormone that helps maintain the body's balance of sodium and potassium. While Addison's disease can be a serious condition, with regular monitoring and the right medication, dogs with this disease can live a happy, normal life. Regular veterinary checkups are crucial to monitor the condition and adjust medication as necessary. Lastly, epilepsy causes recurrent seizures in dogs. This neurological disorder is often characterized by sudden, uncontrolled bouts of shaking or twitching. Dogs may appear dazed, unsteady, or even lose consciousness during a seizure. The underlying causes of epilepsy can range from brain abnormalities, toxins, to genetic predisposition. It's important to note that while epilepsy can't be cured, it can be managed effectively with the right medication and care. Regular vet checkups are essential to adjust medication as needed and monitor your dog's health. While it's often genetic, medication can control the episodes, maintaining a good quality of life for affected dogs. Understanding these diseases helps us protect our dogs. We've learned about a range of health issues, from highly contagious viruses like parvovirus and distemper to bacterial infections like leptospirosis and parasites like heartworm. We've also covered common conditions like pancreatitis and gastric torsion, as well as serious diseases like cancer and epilepsy. The key to keeping our dogs healthy is awareness, prevention, and quick action. Regular vet visits, vaccinations, and preventive care are key. Stay informed and keep your furry friends healthy.